Okay, so pregnancy is this amazing journey, right? It's full of incredible changes, but let's be real, those changes can bring up a lot of new questions about your health. Today, we're going to talk about one of the most common concerns out there for expecting moms, urinary tract infections, or UTIs. Our goal here is to give you the clear, straightforward info you need to feel confident and stay healthy.
You've probably asked yourself this a dozen times already. You feel like you're running to the bathroom constantly. But is that just the baby using your bladder as a trampoline, or could it be a sign of something else? Let's clear up that confusion right here, right now.
First things first, what even is a UTI? Well, pretty simply, it's an infection that can happen anywhere along your urinary system, that whole pathway that includes your kidneys, your bladder, and all the tubes connecting them. Now, UTIs are pretty common in general, but pregnancy, well, it kind of creates this perfect storm that can make you more likely to get one.
And that brings us to our first big topic, learning how to listen to your body and spot the signs. Honestly, knowing what to look for is probably the most important first step you can take.
Okay, this is where you really need to tune in. That frequent urge to pee? Yep, totally standard pregnancy stuff. But, and this is a big but, if that urge comes with a painful or burning feeling, or you're getting pelvic pain, or worse, a fever and chills, that is not just the baby anymore. That's your body waving a red flag that there's an infection that needs attention.
And there are a few other signals to watch for. Take a look. Is your urine cloudy, or does it have a really strong smell? Or do you see any pink or red, which could mean blood? Another classic sign is feeling that intense, gotta go now urge, but then barely anything comes out. All of these are major clues.
So why? Why does pregnancy suddenly make you so much more vulnerable to these things? I promise it's not just random bad luck. It's actually a direct result of some really fascinating biological shifts that are happening inside your body. It really starts with your hormones. There's a key pregnancy hormone called progesterone, and its job is to relax muscles to make room for your growing baby. The thing is, it also relaxes the muscles of your urinary tract. This slows down the flow of urine, which accidentally gives any bacteria hanging around the perfect lazy river to set up shop and multiply. And then there's just, basic physics. As your uterus gets bigger and bigger, it puts a ton of pressure on your bladder. That pressure can make it really tough to empty your bladder all the way out. And any little bit of urine that gets left behind, well, that can quickly become a breeding ground for bacteria. And finally, as if that wasn't enough, the actual chemistry of your urine changes. It can become less acidic, and sometimes it has more sugars in it, which, you guessed it, bacteria absolutely love. So these little changes basically strip your urine of its natural ability to fight off germs and roll out the welcome mat for an infection. Okay, so we've covered the what and the why, but it is just as crucial to understand why it is so incredibly important to catch this early. This is about protecting both you and your baby. This quote really just gets straight to the point, doesn't it? A UTI during pregnancy is absolutely not something you can just wait out or hope goes away on its own. The potential risks are serious, which is why acting fast is so important. Here's the deal. An ignored bladder infection can actually travel up to your kidneys. That causes a much more serious infection called pyelonephritis, and that can lead to some really scary outcomes, like preterm labor or a baby with a low birth weight. It's like a chain reaction, and taking action early is how you break that chain. All right, let's pivot away from the risks and talk about solutions, because the best news of all is that you are not powerless here. There are very clear, simple steps you can take to protect yourself, and really effective treatments if an infection happens anyway. Think of this as your 6-step prevention plan. These habits are so simple, but they are incredibly powerful. Staying hydrated literally helps flush bacteria out of your system. Wiping front to back is a non-negotiable. And all the other steps, peeing often, choosing breathable cotton undies, and skipping those irritating scented products, they all work together to create a really strong defense system. And here's an amazing safety net you don't even have to think about: your regular prenatal checkups. A lot of the time, your doctor will test your urine as just part of the routine. And that is fantastic, because it means they can catch a brewing infection before you even feel a single symptom. So what if you do everything right and you still get a UTI? First of all, please do not worry. This is the most important thing to hear. UTIs are completely treatable with antibiotics that have been proven to be perfectly safe for both you and your baby during pregnancy.
Yep, your doctor has several great safe options, like amoxicillin or cephalexin. The number one rule is to always follow their instructions. And I cannot stress this enough. You have to finish the entire course of antibiotics, even if you start feeling better after a day or two. That's how you make sure you knock the infection out for good.
So, as we wrap things up here, let's just boil all this down to the essentials. When it comes to your health during pregnancy, knowledge really, truly is power. Let's just quickly recap the 4 most important points. Number 1, UTIs are super common, so if you get one, you are not alone. 2, if you even think you have symptoms, call your doctor right away. 3, those simple daily habits are your absolute best defense. And number 4, catching it and treating it early is the key to keeping you and your baby safe and healthy. And this right here is the final, most critical message we want to leave you with. You have to be an active partner in your own healthcare. Trust your gut. Listen to what your body is telling you, and never ever hesitate to pick up the phone and call your doctor.
It's a powerful question to end on, isn't it? Throughout this whole journey, your body is constantly talking to you. Learning to listen is the single greatest tool you have. Stay informed, take care of yourself, and stay well.